Okay, I think we're running. Let me just double check on YouTube, see how it sounds. Make sure it sounds good. Hopefully it does. I think we're okay. Okay, very good. All right, then I'm just going to share this on Twitter, and then we'll get going. Okay, almost ready to go, so sorry for the delay. All right, there goes that. Here we go. Here goes this. I think that is everything. And so I believe, without further delay, here we are, ready to rock and roll. Hello, good afternoon, good morning, good evening, whoever you are, wherever you are. This is yet another episode of UnShrink Me, and I am Dr. Patrick Lockwood. For the purposes of this podcast, I'm just Patrick. Please don't sue me, but feel free to cancel me. This is a weekly podcast all about mental health. So if you are brand new to this podcast, if this is the first time you're listening, just know that the whole point of this podcast is to take popular ideas discussed online, on Twitter, other places, and talk about them openly, honestly, critique them in a way that hopefully is reasonable so that you, the viewer, you, whoever you are listening, can maybe get something out of it. Because my main goal with this podcast, if you're brand new to this, is to protect the public from the profession, to give you a chance to get more out of your clinical provider. So if you are seeking therapy, counseling, coaching, psychiatry, couples counseling, so on and so forth, then I want you to get the most out of it. And so sometimes popular things online are absolutely spot on, and sometimes they're absolute garbage, and sometimes or often they're in between. And so I'd like to openly critique and discuss ideas from typically like therapy Twitter, so that you can have a better understanding of these ideas, and so that it will make your experience of trying to achieve your mental health goals better. However, just to be clear, this is not mental health advice for you specifically. So I am not giving you professional advice that you should specifically do. I am talking about ideas generally enough, and you can go think about them, maybe talk about them with your own mental health professional if you have one. So my goal is not to tell you what to do. My goal is to criticize ideas, explore the pros and cons of them, so to speak, and then you can take whatever you heard that you found interesting or compelling and go talk to the people in your life that support you and maybe get something better out of the services you're seeking. So that is my goal, not to give you specific therapy advice. If you are brand new to this, I will be live tweeting and posting. And so my handle on Twitter, if you're brand new to this, is at AlobhaPatrick, at ALOBHAPATRICK. So feel free to follow me on Twitter so you can follow along and fact check me for the things that I say. And last but never least, this podcast is not NOT sponsored by Celsius. But I love this stuff. It's great, and I have some every week. It's excellent. So today on the podcast, we have a lot of important stuff to discuss, including the research on clinical psychology concepts, including is this normal or is this pathology, and also brainwashing, and what does that mean in the context of therapy, psychiatry, counseling, and so on and so forth. And for those of you who are brand new and you're here in the chat watching and listening, thank you for being here. But if you're brand new, just know that I try to start with kind of a softball, easier to warm up to topic so that we can get into the deeper, more important things of the day. And so I want to start this week with a softball from myself, actually. So I talked about this about 2 weeks ago, and I just want to say this on this podcast right now. Okay. All right. So on the 17th of May, I quote tweeted someone named Dr. Roger McFillin. His handle is at DRMCFILLIN. And on the 17th, here's what I said. Number 1, CBTI, as in CBT for insomnia. Number 2, more walking or body weight squats in between periods of sitting. Number 3, basic calorie in-out tracking with a commitment to minor changes in food intake. Where the boys at? Oh, looks like a lot of my friends are here. Hello, Jake and other Jake. Glad you're here, Jakes. So again, here's what I said about 2 weeks ago. Number 1, CBTI. Number 2, more walking or bodyweight squats in between periods of sitting. Number 3, basic calorie in, out tracking with a commitment to minor changes in food intake. This trifecta would solve 50% of so-called mental health problems. Now that might sound like a drastic take because it's basically simplifying so-called mental health issues, in quotes, to sleep, eating, and exercise. And for those of you who are not on Twitter and do not follow me, I talk at length, ad nauseum even, about how important sleep, exercise, and eating differently is for your mental health. So let me be 100% clear that, I do not believe that eating better, sleeping better, and exercising more would cure mental health problems, because I don't think many of the things that we actually consider valid diagnoses are curable. I think they're manageable. So what I genuinely believe is that of the things that are not curable, of the things that are situational distress, of the things that are resilience issues, you could increase resilience by sleeping better, eating better, and exercising more. Because the more metabolically healthy we are, the better we do. Now, is it super easy to sleep better? No, of course it's not. Especially for those of us who live in the West and work absurd hours or whatever. That's why I recommended CBTI, cognitive behavioral therapy for insomnia, which I happen to, help people with as well in my career. Now, the thing about that is CBTI is difficult because sometimes people need to do things like sleep restriction to get back into a better rhythm, and that sucks real bad. But it's doable for the vast majority of people. And so changing your sleep habits, changing your eating habits, and changing your moving habits is what I'm arguing for. And for the vast majority of people that are struggling with stress and anxiety and sadness and mood issues and things like that, it's very often the case that you don't actually have a diagnosis. It's often the case that people that are just struggling are experiencing ordinary distress and ordinary challenges. Ordinary does not mean not a big deal. Ordinary stress is a big deal. Life changes are a big deal. My point is not they're not a big deal. My point is they are a big deal, but they're not necessarily at the level of illness per se. And so for me, that is what I believe is important, is to be clear that eating better, sleeping better, moving better are not solutions to actual verifiable mental illnesses. Unlike Chris Palmer or something like that, who believes you can keto away certain mental illnesses. That's not quite my take. My take is, if you want to make your body and mind generally more robust and resilient, if you change your habits around eating and sleeping and exercising, and you notice that your life gets a little bit marginally better because of that, you'll feel more empowered and you'll be metabolically healthier, which means you'll have an easier time walking and moving and hanging out and joking around and all these things. So I'm not saying this cures anything. I just think it's better, I just think it's better when we feel physically better. And if we feel physically better, we're much likelier to do and live better, so to speak. Jake says, CareerFlex says, Porfiry Ivanov, a Russian mystic, talked about the benefits of acute stress on the body, exercise, cold heat, in the early 1900s. Yeah, and this is not a new idea. I am not some kind of amazing rebel or brilliant sage with this idea of eating better, sleeping better, and moving better. I'm just saying that if we focus our energy there, it's easier to do all the other things in our life. If it's easier to regulate your mood because you feel less shitty when you wake up because you're sleeping better, then you're probably going to have easier time with relationships. It's probably going to be easier to go to that job you like or don't like, or get more out of your job, or get more out of your friendships and relationships because you feel physically better. That's all I'm arguing. And for the people that think they have a mental health problem that don't actually, it will probably get rid of that extra distress that's making you erroneously think you have a mental health problem. So that's all I'm trying to say. And I think that's a pretty understandable take for most people. Now, my colleague here in the chat says, the problem with the exciting modern age is that we often forget that there is a brilliance in the basics. Yeah, I mean, the basics, I think the basics get easily overlooked because we're so busy chasing money and status and all these things. And that's fair enough. And sometimes it's fun to chase those things and to have more money or more creature comforts or whatever it is. However, it's very, very important that we never forget the basics, because the basics are what keep us sane, in my opinion. Basic relationships, basic habits keep us sane. And it's hard to stay sane when you're so busy focused on all the stuff of the world nowadays. So just for what it's worth, I think it's important to keep eating, sleeping, and moving at the top of our minds so that we don't lose sight of the basics. We are a species, the human species, we are a species that needs and benefits from some degree of staying active and having some relationship with our basic habits. And it's very easy to get lost in the hustle and not pay attention to the basics, in my opinion. So that is all I will have to say about that, which leads me, interestingly enough, to the next topic, which is from Tweet a Therapist. But before I do that, Dank Memer, thank you for being here, says, people might say that is ableist, not me. Yeah, so let's talk about that real quick, because I think this is very important. So I'm sympathetic to the concept of ableism because there are people who genuinely are disabled. And that seems like an uncontroversial, common sense thing to say. I don't know. Maybe it is. What I would say is that the vast majority of people who have some kind of disability usually still have the ability to do something to sleep better, eat better, and move more. Hey, Ryan, glad you're here. I'm born to run. Yeah, listen, is it ableist to say that you could feel better if you were to eat better, sleep better, and move better? I don't think so, because hello, Megan, I just don't imagine that the vast majority of people have 0% capacity to improve their habits just because of their disability. I have seen all sorts of people with different disabilities in my clinical career get better because they develop better habits: sleeping, eating, talking, socializing, boundaries, etc. Hello, Phil. I will certainly unshrink you. So, got a lot of people here in the chat. Glad you're here. But we're talking about eating better, sleeping better, and moving more for the sake of just establishing more baseline resilience. And the vast majority of people, even with chronic conditions, can do this. And it happens all the time. So, excuse me. So what I believe is, I don't believe at all for a second that it is ableist to say we can do some things about our basic health habits to feel better and get better. Which is different than saying, unless you eat better, unless you sleep better, unless you move more, you're a loser or whatever. I'm not saying some stupid shit like that. I'm literally saying that whatever your capacity is to eat better, sleep better, and move better, it will probably make your life better in some way. Will it cure you? No. Will it magically heal you? Probably not. Because people are complicated and life is complicated. But could it make you more resilient in some way if you were to sleep better? Or if you were to have better dietary habits in some way, eating habits? I think so. Plus, it feels really good. I can say from just my personal experience, as I've gotten older and as I've developed better relationship with the gym and with eating and with moving and sleeping in particular, that I feel better about myself because I'm noticing that I can do things to improve my situation even if it's not magically curing the ills of my life. Right? Dank Memer says, people complain sarcastically. If only it was so simple to cure my depression. I wish it was that simple. I really do. I wish you could keto away your depression. I wish you could run 5 miles a day and be cured of your major depressive disorder or your PTSD. It's just not going to happen for the vast majority of people because the vast majority of people are really complicated. And I think when you respect people, you see how complicated they are, which doesn't seem super controversial, right? So my take is, to the extent that we can do better with regard to eating, sleeping, and moving, it will probably promote some baseline resilience for us and lift the floor a little bit so that we can live a better life in our relationships, our jobs, our families, and our friends. It won't cure most people, I would imagine. The gym has not cured me, obviously. Sleeping better has not cured me. Has it made my life easier? Absolutely. 100%. The more consistent my habits around eating and sleeping and moving, the better I feel. And I'm grateful for that. And I just think most people can, right? So this also leads me to the next post, and thank you all for being here and chatting, which is from someone I like on Twitter named No BS Therapist. Her handle is at @tweetatherapist. So let me discuss this right now. Let me repost it real quick. Okay. So, tweet a therapist, or No BS Therapist. Here's what she said. Career Flex, before I get to her post, Career Flex says, yo, what are your thoughts on intensive blood tests to assess hormones and other biometrics as part of mental health care? Just to say 30 seconds on this, I think if you're a mental health practitioner, you should be concerned about the physical well-being of your patients. No question. And so your patients probably should see a doctor, etc., to see if their hormones are okay, thyroid, testosterone, estrogen, etc., because we all need these hormones in some balance to be physically healthy and psychologically stable and resilient. So yes, Career Flex, Jake, I think plenty of people should check out their hormones and other basic nutrient needs because they might feel shitty because they have a vitamin D deficiency. I had a patient like that a month ago. So definitely take care of yourselves. Not that those things will cure you, but they certainly make life easier for you if you feel physically better. So yes, hormone testing, blood testing, usually a good idea, especially if you're over the age of 30. All right, so No BS Therapist, who I'm, I guess, friendly with, I don't know, on Twitter said about a day ago, is this a red flag or is it a normal interpersonal wound? Is this a pattern or a bad week? Is this a diagnosis or a behavior description? Is this abuse or incompatibility? Is this manipulation or bad communication? Is this a trauma response or an ordinary insecurity? So this post of compare and contrast, or this versus that from No BS Therapist, like, is this a pattern or a bad week? I think that's a great juxtaposition because especially online, if you're on Instagram, Twitter, YouTube, whatever it is, and you have like a parasocial, like a sort of real relationship with people, it's very easy to get a very convenience or biased data set about them and miss the forest for the trees, so to speak. So my belief is you might be noticing a pattern, but you might also be overstating a pattern about someone's bad week. We do this all the time in relationships because we're not perfect or something. So, we might think some behavior is abusive when in reality it's just you don't get along very well, right? Abuse is not some objectively perfectly definable thing. And just because a person talks a way that you don't like doesn't mean they're actually being abusive to you. Those aren't the same thing. So it's really complicated how we have parasocial or superficial relationships with people. And this goes for mental health too. The idea that every type of distress or everything that can look like a symptom is actually a mental illness is a problem. And not every stress you experience or every trauma you experience or every sad period or whatever it is mental health problems. Because differentiating between ordinary distress and suffering from an actual illness is really, really, really important. And as Jake said, maybe they're just rowdy, So my belief is that we should be extra cautious. I believe mental health professionals in particular should be extra cautious in jumping to a diagnosis with their patients, number one, but number two, with like people online. So if you're on therapy Twitter, and God bless you if you choose to join the cesspool that is therapy Twitter, but if you're on there, just know that like there's a bunch of different types of personalities with different types of interests and wounds and personality styles and traumas and all these things. And so it's a really weird ecosystem full of mostly strange people, And so I would not take therapy Twitter very seriously because it's not the place where mental health lives per se. It's the place where the people who like attention go, which means there's something different about us, myself included, by the way. And I did an entire podcast about how I'm different and the various ways in which I'm different like 3 or 4 weeks ago. Go check that one out. And I tried to be honest. I don't know if I succeeded, but I tried. And so generally speaking, we should be slow to diagnose and quick to understand and be curious about something, as opposed to fitting it into a nice, convenient diagnostic box. I would say generally people. Ryan says, they're very strange people, and that's why they're my people. Exactly. I like strange people. That's why I want to be friends with people online, because it's cool to be around different types of people, even people that I don't always agree with, and which is everybody. So is this a red flag, or is it a normal interpersonal wound? As No BS Therapist said, absolutely important to differentiate. And here's the thing. When we have a strong emotional reaction to someone, and you call that like a red flag, that strong emotional reaction can be 90% about us and 10% about the other person. Or it can be 50% about us and 50% about the other person. And it takes time and distance and reflection to actually understand the percentages accurately, I think, for many interpersonal situations. Sometimes it's super clear, super quickly, but rarely, I think, is it that simple, right? So I really hope that everyone, especially all of us online, kind of like give ourselves a break and give other people a break, because like it's okay if I'm not your cup of tea. However, having a bunch of thoughts and feelings and worrying and all this shit about it, man, that's super intense, Like there certainly are serial killer types in therapy, I'm sure, who are out there molesting people, which happens unfortunately, or hurting people. That's pretty rare, thank goodness. You know what I mean? That's, I think, pretty rare. And so the weird, the confusing, and the sick often become clinicians. And it's important for us to have some space and some grace for all the people that are very different. You're also my cup of tea for various reasons, Career Flex, as is Ryan and many other people here. Because, I was talking about this with Ryan on his podcast, which I encourage you to go check out. He's got some really interesting interviews with people very different than myself. But like, if you think about society as an ecosystem, right? And I think this is really important because I think it's easy to get lost. It's easy to get lost in the drama and the scuffle and the chaos and all this stuff and my tribe and your tribe and all that crap. If you think of society like an ecosystem, then it's really, really, really important that there are different types of people that serve different needs in your ecosystem. If you go to any different type of ecosystem, a tundra, a desert, or whatever it is, each creature in that ecosystem serves a very different purpose, right? And so in deserts, you have cacti. In deserts, you have scorpions and tarantulas and all these different kinds of creatures. And so many people, detest these animals, but they're very useful in that ecosystem, right? People don't like getting pricked by cacti, but that cactus is useful in that ecosystem. And so humans are no different, in my opinion. You have different personality styles, different traumas, different intellects, different curiosities, all these things. And it's my belief that different types of people are useful for different niches and traits and habits in our ecosystem we call society. And so I want everyone, with whatever their differences are, to live in their little niche and do what they're great at and excel. Whether I like them or not, whether they're my cup of tea or not, whether they're morally amazing or morally terrible. And that's my approach to people because I think it's the one that gives the most flexibility and the most grace to people. Because people have grace for me, and I think I should have grace for other people. I am not everyone's cup of tea, and there are tons of people professionally I could never work with because I'm not good at it. I don't have emotional tolerance for it. It's not interesting to me, so on and so forth. And that is important to keep in mind, is that on Twitter, on any social media, in real life, this ecosystem we are lucky to be a part of, in my opinion, we can easily take for granted and pretend that it's only the people that agree with me. It's only my moral tribe. It's only the people that think like I do. I'm objectively not a Nazi or not a communist or not a whatever stereotype bad group of people. And it's just, if you care that much about the online world that you get morally outraged about shit, I don't know what your problem is, in my opinion, because it's just fucking Twitter. I don't know. It's just me. And so I would just say, let's enjoy the ecosystem and appreciate everyone in the ecosystem for what they're good at and what they're not good at, and let them do their thing. And I think life gets better when we allow every creature in the niche to balance each other out. That's my belief. So is it illness? Is it a bad week? Etc., etc. Now, Jake says, you are a gym bro with the appreciation for the bros. I have met worse. I am certainly not a gym bro, but I certainly love the gym for sure. I don't know. Maybe I am. Maybe I should take on that identity and just become a full-time gym bro. That'd be fun. Okay. So I want to talk about my buddy Nick Tabor, because I think Nick is fun. There's just so much to talk about with Nick. So let me retweet his post for just a sec. Okay. All right. So on this week's episode of UnShrink Me, which is for Nick Tabor, by the way. And if you don't know who he is and you're not following him on Twitter, his handle is at NICKTABER. So I'm going to start with at least one of his posts. We might get to a second, but this is the first one, and I think this is the most important one for today, at least. So Nick Tabor said this a day ago. He said, and I quote, "Mental health professionals, particularly those that work with children, have the ability to essentially brainwash patients into thinking their services are good for them and necessary, even when they don't actually feel that way, they being the patient. That is why mental health is such a peculiar discipline. The people who try to lump it in with medicine aren't being intellectually honest." So as always, Nick says very scandalous things that are worth unpacking, exploring, talking about. And he always mixes in some things that I obviously agree with most of the time and then also disagree with. So let's break this down sentence by sentence. And let me tell you what I think makes sense, because I don't want people to be turned away from their profession unfairly, right? So first, mental health professionals, particularly those that work with children, have the ability to essentially brainwash patients into thinking their services are good for them and necessary even when they don't actually feel that way. So I think this is true. I think that it happens, unfortunately, in therapy land, the world's worst theme park. I believe that it's often the case that mental health professionals will engage in types of therapy, or even engage in any therapy at all, when it's not actually needed for people. Is it every relationship? Is it 50% of therapies that happen? I have no clue. I couldn't put a statistic on it. Does it happen more frequently than it should? Is it more than 1% of the time? Yes. And especially when it comes to kids, I want to say just a few words about this. And I've had plenty of conversations with my grad students about this, because this is very, 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 very important. And Ryan in the chat here just said something that beat me to the punch. Ryan said, children are vulnerable. Of course, this happens more to them. Right. So one way that I really agree with Nick about this first sentence, that kids are basically forced into therapy, is it is very often the case that if you're a child between the ages of 4 and 13, and you know, you're having some behavioral problem or emotional problem in school, it's very often the case that the teachers or the administrators refer that kid to therapy or counseling or whatever. And then the kid's now given a label. You know, they have some diagnostic bullshit label like ODD or something. And that kid now has a mark on them, and now they get a chip on their shoulder that probably isn't even accurate. Because many of the kids that are struggling in primary school, literally speaking, are not mentally ill. Like, oppositional defiant disorder is not an illness. And everyone I've talked to, especially those that work with kids, like psychologists that I know, agree with me. Oppositional defiant disorder is a parenting problem. Any acting out behavior for kids before, especially the teenage years, is a parenting problem. And I am literally blaming parents in this moment right now. Is it only the parents' fault? Blah, blah, blah. Of course not. But is it predominantly a parenting problem? Yes. And so a lot of those kids are not sick. They're in sick environments. They're in environments that don't meet their needs. They're in environments that aren't available for them in some important way. So it could be a catastrophic environment or just a shitty environment. And the idea that the kid is the problem is, I think, rarely the case. I know some people who work in adolescent treatment who genuinely see very, very sick kids. But a lot of those very, very sick teenagers that are in this adolescent program that I'm aware of were not that way once upon a time, and the system made them worse, right? And so is it the case that every kid is some magically innocent, beautiful, fragile thing that is just hurt by the system? No. Are many kids who are treated not really ill? Yes. I would be willing to say that even over 50% of people that are treated as kids probably don't actually have a real mental health problem. They have a family problem, a parenting problem, a sibling problem. They might be being assaulted or molested, some terrible things that aren't technically an individual illness. So I agree with Nick in that regard. There's a question here in the chat. The School of Flourishing. I'm going through a real hard time in my life right now. Am I able to ask a question about it to see your opinion to my situation? So I appreciate you being here and commenting and asking a question. And what I would say is that, and I say this at the beginning of every podcast, that I am not here to give individuals specific advice. And the reason I don't give specific advice is because it's very ethically and legally questionable. I can't really know enough about you just commenting here in this chat for me to give you an accurate and realistic response. I speak very generally about many topics. And so if you look back through all the podcasts that I've done, there probably is some feedback in there for you. What I will tell you is that if you need help finding a professional, I can certainly help you do that offline whenever you want. However, giving specific feedback like live in a podcast, I don't typically do because I don't want to give people the impression that I'm doing therapy on YouTube, number one. Number two, it's not really ethical, and it's also not respectful to you because I can't really know enough about you, if that makes sense. So although I appreciate you being here and asking, I would say that if you want to talk to me offline at some point, I encourage you to find me on Twitter and go into my DMs and let me know it's you from the podcast. And then I can pay a little more attention to you and maybe help you find someone that you can talk to about your specific issues, because I genuinely don't want to do the guru thing, and I'm not here to be, a YouTube psychologist, if that makes sense. So as much as I'd like to be able to help you, I don't think it's ethical or respectful to you to take up this time in this live stream and try to kind of like work with you professionally here. And it's not because I don't respect and appreciate that you reached out. It's just that it's not respectful to you, I believe. And it's hard for sure. The School of Flourishing just said, appreciate that a lot. Thank you. I'm based in the UK and it's very multifaceted. I work in the mental health and well-being too, so I do understand that. Thank you. Of course, you're welcome. I want to do the right thing if I can. And as tempting as it would be, there's a part of me that's prone to, narcissism and guruism. I don't want to do that, So, if you want to find me on Twitter, my handle is at alobhapatrick, at ALOBHAPATRICK. And you can hit me up in my DMs and I can pay a little more attention to you and I can push you in the direction of someone that might be able to help if you want. So, So, to go back to Nick Tabor, again, I agree that it's easy for kids to be harmed by therapy. It's easy for kids to be brainwashed, right? So let's talk about that, because that's what he said. To think that the services are good for you is a tricky thing, because it's sometimes the case that the kids that don't need therapy but get it anyways, it might help them even though they're not acutely mentally ill. That's possible. So is it like all good or all bad? I don't know. I think some kids probably get some help from their school counselor or therapist or whatever it is. And I'll just give an example. Out here where I live, some of the MFT students that I've worked with and supervised have worked in schools out here. And they're just interns, so they don't really, have any authority in these school systems. And so the principal or vice principal will refer some kids to them. And many of the kids they're working with aren't actually mentally ill, but they're actually getting something out of the therapy relationship with that intern because it seems like the kid is going through some stuff. And I can remember one of my interns at one point, when I was supervising for the school's internal clinic, had this complicated relationship with the kid and the kid's two parents who are also separated. And so there's this really weird triangle between the kid and the two parents and all this stuff. But the therapist, the intern therapist I was supervising, was able to help that kid learn how to speak up for themselves and have a better relationship with that kid's parents. So that kid wasn't mentally ill. That kid didn't need psych meds or shock therapy or rehab. The kid didn't even have an individual diagnosis that was like super valid in my opinion. But enough psychosocial distress with their parents that learning how to speak up for himself actually made his life better. So was that therapy useless or brainwashing? No, I think in that particular case, my intern was doing that kid a solid by being, a reasonable adult. And I was trying to encourage my intern to not, overly pathologize what they were experiencing with the kid. So I don't think it's all brainwashing. I'm sure it happens sometimes. And the last thing Nick said is that the people who try to lump mental health in with medicine, aren't being intellectually honest. So this is one of Nick's hobby horses, that psychotherapy and related similar disciplines, counseling, etc., are not really medicine. And on the one hand, I agree. Therapy isn't really like medicine in many ways, especially more depth-oriented, analytic, kind of, as our buddy Ed Perrin would say, like developmental therapy is not like medicine. It's not like you have an infection, you get some antibiotics and you get better in a week or 14 days. That's not normal, right? So I agree that in many ways, actual therapy is not like medicine. However, it works in the medical model because, unfortunately, this is the best way to pay for it in today's society when people have less cash in many ways. Now, some people have enough cash to pay for it themselves, but the insurance model is what a lot of people can afford, unfortunately. So we do the best we can with the very, very broken systems that we participate in. And as CareerFlex just said in the chat here, too much introspection leads to sadness. There is such a thing as being too in your head. And depending upon the type of therapy you're experiencing, you might have someone who's maybe not wholly incompetent, but kind of incompetent, who encourages you to live above the neck, which is just not life. I don't think that you're doing better if you're thinking about yourself all the time. That seems like actually a terrible way to live. So I think the question becomes, is therapy generally brainwashing? I don't think so. Does it happen sometimes? Yeah, probably. Does it happen more often with kids? Absolutely. And so reforming the way that schools and all these other systems handle children with behavior differences and behavior difficulties and emotional problems, I think is a huge problem. I think it's a huge need. And some people say that the solution to that is just more clinicians in schools, and I do not believe that's better at all. Because I think kids that are struggling have a multifaceted problem. Kids that are struggling typically have family issues, developmental issues, peer issues, friend issues, maybe learning differences. And so those different layers are not always best helped by a therapist. Sometimes they are. Sometimes like a good family therapist can help those parents figure their shit out and become better parents for that kid. And so maybe some of the distress goes away. I once worked with a woman who had just this very, very difficult life by all objective measures. And she had a young son who was like early adolescent, but he was acting all ODD and ADHD. And then we had some conversations about what ODD actually is, as I said earlier. And she and her husband had some strategic conversations about how to deal with their elder son. And after about 2 weeks of dealing with him differently, all this ODD stuff just disappeared, right? Now, I'm not trying to promise some miracle cure. I'm just saying that like learning how to have better parental boundaries and communicate better and be on the same team is extremely important for parents. And kids respond better when the parents are on the same team and have a similar approach to raising their kid, which is not weird, like strange to say, I hope, Ryan says, no more social workers. Help the ones that exist to be better. Yeah, for sure. So, dearest Nick Tabor, thank you for the grist for the mill. What I will say in summary is that sometimes therapists will use the informed consent process to quote unquote brainwash their patients. However, brainwash is a very evocative term, and I don't think that it adequately captures the spectrum or the diversity of things that happens in good therapy. Because good therapy and bad therapy can often look very similar, unfortunately. However, appropriate informed consent can solve a lot of these problems. And so if you do the very lazy version of informed consent, and if you're out there and you're listening to this, and you yourself are in therapy, or you yourself have a loved one who is in therapy, etc., counseling, rehab, whatever it is, I want you to hear this loud and clear. The most important thing, in my opinion, is the informed consent process that happens at least at the beginning of therapy. So the informed consent process is where the professional therapist, psychiatrist, psychologist, whatever, sits down with the patient or family or whatever the constellation is. And when the professional sits down with the patient for the first time and says, help me understand what you're going through, and they get an idea together of what the problem or problems are. So step one of informed consent is mutually understanding and identifying problems. Step two is describing from the therapist's perspective what they think might help, what the pros and cons, because there are cons of every therapy approach, what tools and tricks might work for you, and what might not work for you. The ways that these therapy tools and tricks might harm you is also a big part of how informed consent should be happening. Also, how long we expect to work together, which could change, by the way. What we expect are reasonable goals is another important part of informed consent. So we have to mutually describe and discuss and clarify the goals together. And so those four simple things I just described, that conversation, if it's done right, can take 20, 30, 40, or even an entire session. Because if you really respect the patient, you're going to try to really understand them. You're going to try to understand what they think will work and what you think will work. You're going to describe what you think might help them and also might hurt them. Because much of what we do in therapy could harm people. It doesn't always, but it can. And we always have to be clear with patients that it's their therapy, which means they can opt out at any time. They can leave at any time. When you respect people, you let them know that it is their choice to leave at any time. We are never to coerce people into staying in a professional relationship. So those things that I've listed often never happen for kids. And unfortunately, don't happen in a very thorough or detailed way with adults. And so brainwashing certainly can happen when the professionals are not doing informed consent, as I just described, but there's more steps. And as CareerFlex just said, this is why I ask at least every 2 sessions, how is this working for you? When I'm doing more clinical work, I ask, how is this working for you? Back when I worked in rehabs full-time as a clinician, if I did a group or an individual session, I would ask them every time, how is this going for you? When I do group therapy from time to time, I always ask, how did this group work for you? Was it useful? Was it not useful? In what ways? Right? Because that is respecting the patient's autonomy. And if I did something that's not helpful, I need to understand what it was from your perspective, because my perspective is very different than yours. It's impossible for me to understand how something affects you unless you tell me specifically. And so, yes, brainwashing happens when the therapist pretends that everything they're doing is working and doesn't check in with people. Therapists like to sometimes pretend that they're not going to hurt people, which is also absurd. So for me, I kind of agree with Nick, and I kind of do not agree with Nick, as always. So I hope this helps, and I hope that that was useful and interesting for you. The last topic I have for today is maybe not as controversial, but we'll see. So, let me retweet something real quick. And then we'll get going. All right. So here we are at minute 45, and we are talking about our last topic. Jake says, where's the cat? The cat, I don't know where the cats are. One of them is passed out. You cannot see, way over there. And then the other one, I think, is upstairs somewhere. Who knows? So this last topic is a little controversial, but maybe not. I don't know. So there's this, I think, physician that I've interacted with a number of times on Twitter, and his handle is at the Recovery Doctor. His handle is at Recovery Doctor, and his name is Michael Osticher. I think I said that correctly. I'm sorry if I said that wrong, Michael. So anyways, Michael said, in response to someone talking about the evidence of SSRIs and how effective SSRIs are, he said, could be, could not be, we need better studies. So, and I said, like most topics in psychology and psychiatry, we need better studies. Yeah. Hey, Jonathan, glad you're here. Bad storms last night. You had some sleep issues? Hit me up if you want to talk about it. So, Michael, Dr. Osticher, I think is your name. If I'm saying that wrong, I apologize. Said, we need better studies about the effects of withdrawals of SSRIs. I said, like most topics in psychology and psychiatry. Now, what I'm about to say is going to sound maybe controversial to people that don't live in academia like me. You know, I spend half of my week as a professor, which I'm very grateful for. And I talk to other clinical psychologists a lot, because I'm trying to understand what the data say about these various things we're teaching our doctoral students and master students. And so many people are under an illusion, which is that the field of clinical psychology and psychiatry has some rock solid set of evidence for different types of psychotherapy, psychiatric medications, and other interventions. And what I will tell everyone watching and listening is that it is not remotely true that we have decades of airtight, rock-solid data on everything in clinical psychology. We don't. We really don't. We have, I think, some moderately good data and a lot of very low-quality data. You know what I mean? So let me be very clear about this. And if you don't believe me, I want you to fact check me, because if I'm talking out my ass, you should definitely come at me about this. So if you go, as much as I do not like the American Psychological Association, and I don't, Division 12 of the American Psychological Association has an entire list of evidence-based interventions. And that list has specific criteria that examines and kind of like criticizes the evidence base for each of these interventions. So like CBT for PTSD, CBT for depression, ACT for depression, ACT for OCD, all these different types of things. And it's this, again, Division 12 of the American Psychological Association has a list of different topics, clinical topics, and the evidence base for each of these interventions for these topics. And so if you go to Division 12's website, you'll see if they have low quality, intermediate quality or high quality data that says, yes, this is effective for this issue. Yes, CBT is effective for major depressive disorder, and so on and so forth. And so what I will tell you is if you actually look at the review, like the Prisma review for each of these different, clinical studies, or like a Cochrane review, for instance, in the UK, like it's very much the case that most clinical psych interventions are low to moderate quality in terms of their evidence. We do not have decades and decades of high quality data because much of the clinical psychology treatment data, treatment using CBT, treatment using ACT, treatment using psychodynamic therapy, is a bunch of low quality small sample studies. And I want you to think about this with me for a second. Is it actually possible to do a perfectly high-powered, scientifically, statistically robust study with most clinical psychology or psychiatry topics? No, because most of these topics are rather complicated. It's impossible. I explain this to my students all the time. It is impossible to design the perfect randomized controlled clinical trial. And the reason is because you can never rule out all the moderators and mediators. You can never rule out testing effects. Many of the measures we use are just garbage. The Hamilton for depression, the PHQ-9, the GAD-7, all this flimsy stuff is pretty essentially useless. It's not quite astrology, but it's close. And so what I would say is that the idea that we have some expert, perfect opinion about how these interventions work is just not remotely true. And anyone who disagrees with me, I think needs to actually take a look at the literal reviews of all these interventions. And I like a lot of these interventions. I use CBTI. I've used ACT components many times in my career. I've used a lot of psychodynamic concepts and psychodynamic therapy in my life. And so I don't think that it's about the scientific knowledge base at all that will give us permission to do the things that we're doing. Because the idea that we're going to have some perfect set of randomized controlled trials, we have enough randomized controlled trials with white people and black people and Asian people and Latin people and straight people and gay people and bi people and trans people and young people and old people and smart people and stupid people and disabled people and non-disabled people and all this crap. Like, it's just not going to happen. It's just never going to happen. Because the world is imperfect, and research is mostly done, clinical psychology research is mostly done with acutely ill people. It's also mostly done with convenient samples of people in treatment centers and rehabs and outpatient clinics. But there's a lot of people that are mentally ill, legitimately, who don't have the funds or resources or ability to go to a therapist, a psychiatrist, a clinic, a rehab. And so all the clinical psych trials are missing all the people who are not there. And there's so much stigma in so many communities about getting help. Out where I live here, there's a large Latinx, whatever fucking communities out here who genuinely have all this stigma about getting help. And so there's so many people from those backgrounds that never participate in research. And we don't really know what is more effective for them, for instance. So what I will tell you is that if you are trying to rely on the supposed gold standard of randomized controlled trials, you are a sophist, in my opinion. You are not actually trying to be serious about what exactly is happening in psychotherapy, in the treatment of individuals. Does it help to have a scientific knowledge base that we can generalize from? Yes, absolutely. But is a randomized controlled trial really the gold standard for determining what's going to work in therapy? No way. We can never have enough data, number one. And that doesn't mean we should stop researching. God bless. Let's keep doing more and more research. Let's do more research with more diverse populations. Let's do more research with underserved communities. Let's do as much as we can, because I think the scientific study of mental health issues, of actual illnesses, is extremely important. But it doesn't mean that is what we base our clinical opinion on, because expert treatment involves not just our scientific knowledge base, but also our experience doing the work. That's also important, because the feedback we get from actual patients should very much inform how we do what we do. Another thing that should inform what clinicians do is feedback from colleagues, consultation and supervision. Probably one of the most important things for any licensed professional is a consultation group. And the reason I believe that is because it's very isolating, especially if you're one of those types who lives in therapy land in a private practice somewhere. You're hiding. Maybe you're not intentionally hiding, but you're hiding, which means that unless your ideas and your work comes in contact with other professionals, there's no way to verify how helpful you're really being to some degree. But if you're in a consultation group where you have to talk about your cases, then you're getting more feedback about how you're actually doing beyond even what the patient is telling you. So really, in order to be a really solid and ethical and evidence-based therapist, you need feedback from your patient. You need to see how that aligns with what's happening in the literature and with your colleagues. You need all three types of data. You need colleague data, you need patient data, and you need scientific data. And if you have all three types, you're more likely going to be helpful than if you're just doing one thing alone. So it's very, very important to not get caught up in the, oh my God, here's what the research says, because that's mostly convenient sample garbage most of the time. Some of it's great, most of it's not. Most clinical psychology studies are underpowered. Most clinical psychology studies have like third variable problems, like moderators and mediator problems. And so we just need to do many, 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 many more of them. But the human mind, human experience, human psychology is wildly complicated, and not just about the individual, but about their system too. So what I would say is, again, as Michael said in his post, we need better research when it comes to psychiatric medications, when it comes to clinical psychology interventions, family therapy, individual therapy, rehab, counseling, couples therapy. We need much better research. I have zero reservations about more and more people getting their doctorate degree, doing research, contributing to the literature. I think that's awesome. And not just because I'm a professor, but I think it's also fascinating. And we can learn something by doing these studies. So I'm all about it. Also, that is 1/3 of what matters as a professional. If you're a clinician, you should be getting feedback from your peers and your colleagues. You should be getting feedback from patients, and you should be getting feedback from the research. You need 3 types of data to be an ethical professional. And the problem is many people never get feedback from their peers. They hide. One of the worst things about private practice psychiatrists, psychologists, therapists, whatever, is they just hide. And they never have a chance to get pushback from their colleagues. And sometimes I get pushback and it's so good for me, because it even happened this weekend. I got some pushback and it's so good for me because I screwed up. And I learned something, and now I can hopefully do better in the future if I pay attention to what I learned, right? That is part of me getting better at what I do. And if you're a professional in this field, your job should be focused on getting better at what you do, because it's the practice of therapy. It's the practice of medicine, right? That's a phrase that's been used for decades in psychiatry and medicine. And so the therapy is also a practice. And to be good at the practice of therapy, you need personal accountability for your mental health and well-being, but you also need data from your colleagues. You need pushback and feedback from your colleagues. You need feedback from the patients, and you need feedback from the scientific literature. You need 3 types of data to be an effective clinician. And if you don't have all 3 types of data, you are probably missing something important. That doesn't mean you're failing miserably, but you're missing something important, in my opinion. Now, I missed a lot of the chat here, so I'm going to go over to the chat, well, now that my rant is over. Okay. Invented by the pharmaceutical companies. Yeah, like the PHQ-9. Terrible. Ryan says, when I worked, there was no book or study on DC black young boys in special education. I had to figure out a lot on the fly, and studies are of limited help. Exactly. That's what I'm saying. And Jonathan said, your belches are pretty great in general, Patrick, but I think you can do even better. I could do better. My belches are not as loud as they could be. And so in the future, I will work on improving my belches for everyone's listening pleasure, obviously, because it's a big part of this podcast and my shtick, as it were. So I think those were all the topics I discussed talking about today, right? That's everything I wanted to talk about. Yeah, for sure. So thank you all for being here and for chatting and contributing. If you disagree with me, I would love to hear more about what you disagree about. Especially, I'm very interested in this thing I just said, which is, what are the 3 types of data that we need as professionals in order to get better at what we do, which is feedback from our colleagues, feedback from the patients, and feedback from the scientific literature. I think if you integrate all 3 types of data, you will get better at what you do. And so if you're out there and you're a professional, I encourage you to be part of a consultation group, or at least have colleagues you can talk to on a regular basis about what you're doing with your patients. You know, I'm blessed with many good colleagues. And so because of that, I can be a little more accountable than maybe other people who hide in private practice, for instance. Not that private practice is evil or bad, it's easier to hide there. So I really appreciate you being here, and I want your feedback about anything that I could have said differently, or if it made sense or didn't make sense. And because we are out of time, I will have to do a joke next week, unfortunately. But I will see you next week at the same time, same place. This is the Psychology Checkup, and my weekly podcast is called UnShrink Me. So thank you for being here. If you are new to this, please like, share, and subscribe. If you are not on Twitter, get on Twitter and come play around and joke around with us. My handle on Twitter, if you're not following me, is at AlobhaPatrick, at ALOBHAPATRICK. And I will see you all next week. Please take extra good care of yourselves. The world is messy, but you don't have to be. Take good care of your eating, your sleeping, and your moving habits. And have fun. I hope that life is not miserable for you. It doesn't need to be. It can be, but it doesn't need to be. So I hope you're having fun. I hope you're eating good food, sleeping, exercising, having good sex, having good